Arthur woke up with a jolt. A searing pain shot through his big toe. It felt like his foot was on fire. He tried to wriggle his toes, but the pain intensified. "Ouch!" he yelped, clutching his foot.
As he limped to the bathroom, the memory of last night's indulgent dinner party flashed before his eyes. The steak, the creamy mushroom sauce, the red wine. Little did Arthur know, his indulgence had triggered a rebellion. This wasn't just any foot pain, it was gout. Arthur's story is, unfortunately, a common one. Gout, once dubbed the disease of kings, is making a comeback. Gout is like an unwelcome houseguest who arrives unannounced and makes a scene. It's a calling card, a sudden, intense pain that usually targets the big toe, but can also strike other joints like the ankles, knees, wrists, fingers, and elbows. Imagine the worst pain you've ever felt in a joint, then multiply it. That's gout. The affected area becomes red, swollen, and tender to the touch, feeling like it's on fire. Other symptoms may join the party, including stiffness in the joint, warmth and inflammation around the affected area, difficulty moving the joint, and even fever in some cases. Ignoring these signs is like ignoring a fire alarm, dangerous and unwise. If you experience any of these symptoms, it's time to call the fire department, or in this case, your doctor. What causes this excruciating rebellion in our joints? The answer is uric acid. It's produced when we break down purines found in our cells and some foods. Usually, our kidneys flush out uric acid, but overproduction or inefficient elimination leads to hyperuricemia. Imagine uric acid as tiny, sharp crystals. These crystals deposit in the joints, causing gout. Risk factors include a purine-rich diet, obesity, kidney disease, certain medications, and genetics. While you can't change your genes, you can control your diet and lifestyle to lower your risk. Diagnosing gout is like solving a mystery, and your doctor is the detective. They'll begin by asking you about your symptoms, medical history, and lifestyle. Then comes the physical exam, where they'll examine the affected joint for telltale signs like redness, swelling, and tenderness.
But the real clincher is a test called joint fluid aspiration. Don't let the name scare you. It's a simple procedure where we use a needle to extract a small amount of fluid from the affected joint. This fluid is then examined under a microscope for the presence of uric acid crystals, the smoking gun that confirms a gout diagnosis. In some cases, we may recommend additional tests like blood tests to check uric acid levels, X-rays to rule out other conditions, or ultrasound to detect uric acid crystals in the joints.
Once gout rears its ugly head, the goal is to tame the inflammation and send it packing. Thankfully, there's an arsenal of treatments available to combat this painful foe.
Medications are often the first line of defense. NSAIDs like ibuprofen or naproxen help reduce pain and inflammation. Colchicine targets gout inflammation and is effective when taken early. For severe cases, corticosteroids can be prescribed for quick relief.
But it's not just about medications. Play a crucial role too.
Modification is one's eating are key. Avoiding purine-rich foods and alcohol is crucial. Weight management and hydration are also important.
Treating gout involves managing acute attacks and preventing future flare-ups. Section 6. Superfoods to the rescue, aiding gout recovery.
While there's no magic bullet to cure gout, certain foods can be your allies in the fight. These superfoods won't replace medication, but can support your recovery and help prevent future attacks.
These tiny powerhouses are packed with antioxidants and have anti-inflammatory properties that may help reduce gout pain.
Strawberries, blueberries, raspberries, these colorful fruits are rich in antioxidants and vitamin C, which may lower uric acid levels.
Milk, yogurt, and cheese can help lower uric acid levels without adding extra purines to your diet.
Load up on veggies like broccoli, spinach, and cauliflower, which are low in purines and high in fiber, aiding in uric acid excretion.
Remember, a balanced diet rich in fruits, vegetables, and whole grains is key to managing gout. Consult a registered dietitian for personalized dietary advice. Hand Section 7. Gentle steps to recovery, exercise, and gout.
When gout strikes, the last thing you want to do is move. But once the acute pain subsides, gentle exercise can be your friend, helping to reduce stiffness and improve joint mobility. Strengthen muscles around the affected joints, providing better support. Maintain a healthy weight, which is crucial for managing gout. Start slowly with low-impact activities like walking. Aim for 30 minutes most days of the week. Swimming. The buoyancy of water supports your joints, making it a great option. Cycling. Use a stationary bike initially to control the intensity. Yoga. Gentle stretches and poses can improve flexibility and reduce stress. Listen to your body and avoid any exercises that cause pain. Gradually increase the intensity and duration of your workouts as you recover.
HAD Section 8. Your health, your priority. Seeking medical advice.
Gout is a complex condition that requires proper medical attention. This is for informational purposes only and shouldn't be considered as medical advice. If you suspect you have gout or are experiencing any of the symptoms mentioned, please consult a doctor immediately. They can diagnose the condition, recommend appropriate treatment options, and help you manage your condition effectively.
Remember, ignoring gout won't make it go away. In fact, untreated gout can lead to complications like recurrent gout attacks, joint damage and deformity, kidney stones. Don't let gout dictate your life. Seek professional help and take control of your health. HAD Section 9. Deliciously gout-friendly, a recipe book recommendation.
Navigating the world of food with gout can feel like walking a tightrope, but it doesn't have to be a bland and boring journey. To help you enjoy delicious and gout-friendly meals, I highly recommend checking out the Healing Gout Cookbook, Anti-Inflammatory Recipes to Lower Uric Acid Levels and Reduce Flares by Lisa Cicciarello Andrews, Med-RDLD. This cookbook is packed with easy-to-follow recipes that are both flavorful and kind to your joints.
Remember, managing gout is a marathon, not a sprint. By adopting a holistic approach that includes medical treatment for pain management and healthy lifestyle changes, you can win the battle against gout and live a full and active life.